welcome to the show. Always a pleasure to have you with us. This week we're discussing women in Africa and how men can play a role protecting women. We also look at maternal health care, anti-FGM and gender-based violence. We get your views on the issues. And as always, we also have Africa's top 10 for you. You're watching the Africa Leadership Dialogues. I'm Julie Gishuru. On the show this week, we host Siddharth Chatterjee, who is the UNFPA representative to Kenya. Let's take a look at his profile.
Siddharth Chatterjee, otherwise known as Sid, has been the UNFPA representative to Kenya with effect from 10th April 2014. Before joining UNFPA, he was the chief diplomat and head of strategic partnerships at the International Federation of Red Cross and Red Crescent Societies (IFRC), based in Geneva since June 2011. Prior to the IFRC, he served in the United Nations since January 1997. From 2009 to 2010, he was Regional Director for the Middle East, Europe and Central Asian Republics at the United Nations Office for Project Services. From 2007 to 2009, he was Chief of Staff to the Special Representative of the Secretary General for the UN Mission in Iraq based in Baghdad, Iraq. He has also served in leadership positions in UNICEF Somalia, South Sudan, Sudan, Darfur, Indonesia, and with the UN peacekeeping missions in Bosnia and Herzegovina and Iraqi Kurdistan. Before joining the UN, he was a career officer in the Special Forces of the Indian Army. He has written extensively on a range of humanitarian and social issues in a variety of journals such as CNN, Al Jazeera, Forbes, The Guardian, The Huffington Post, Reuters, The Global Observatory, The Interpress Service, as well as some mainstream Indian journals. He has a master's in public policy from the Woodrow Wilson School for Public and International Affairs at Princeton University, USA, and a Bachelor of Sciences from the National Defense Academy in India.
Let's get straight to his insights. Sid, thank you so much for making time for the Africa Leadership Dialogues. A few months ago, we were together in Dadaab and I got to see firsthand the work that UNFPA with other partners like Kenya Red Cross and indeed county governments as well, the work that is being done towards maternal health care, equipping medical facilities to address the needs of women. But there's so much more you're doing as well. So let's start with the He for She campaign. Tell us about that and how do men participate in this campaign?
Well, first of all, thank you for having me here, Julie, a real honor. I think the He for She campaign, which really was started by UN Women, is a hallmark campaign. It's a signature campaign, which really is about mobilizing men, because men are the perpetrators of violence. And it starts at childhood level. You know, when a small boy sees his mother being hit by the father, and the father, you know, and the mother the child is traumatized by that experience, but the mother nudges the boy and says, no, don't worry, it's because your father loves me, that's why it happens. Temperamentally, you're actually putting those messages into a young child at a very early stage. So this is where the challenge is. So that's why I think the He for She is so timely, because the more young boys see young men leading by example, is that change going to take place. But the change has to happen at home, where the husband, where the brother take responsibility and say, there will be no beating of my sisters, there will be no hitting around. Because it really starts at the domestic violence level, and then it's seen as a passage, as a rite of passage for any guy to hit a woman. So I think it's timely, and I was very, very happy and pleased when Bob Collymore and Ambassador Johan Bogström, the ambassador of Sweden, and Linus Kaikai really came together, and we all decided, okay, let's do something about it and put a message out there. But I think if Kenyan men can take that and take it really seriously and mobilize around it, I think it'll be fabulous.
Let's expand it to African men, and we're going to have a serious discussion on why it's so important to focus on issues like maternal health care, anti-FGM, and the other work you're doing. But to put this in context, for African men who want to be part of protecting the African woman, or any women for that matter, how can they be part of He for She?
I think they just have to sign up to that campaign, and it's not just putting a signature, it's on the internet. UN Women has a website, the He for She website, and they can just sign up for it. the most important thing is, having signed up, is to stick by it.
Live by the ideals.
Live by those ideals. Really live by it. Despite anger, despite situations, it is not about hitting a woman. It is about being the value systems that Africa brings, the value systems of chivalry, the value systems of respect. And I think Africa can actually be a beacon of hope for many other parts of the world. My own country, India, is notorious for gender inequity, for the issues of sexual and gender-based violence. So here in Kenya, I just see hope here. You have a leadership in the President and the First Lady of Kenya who are really there. The Vice President have spoken up, in terms of condemning any form.
Deputy President
has spoken up, condemning any form of violence against women. So I just think it needs to be Africa-wide. And Africa can really set the stage, just as Africa is setting the stage economically in every way as we see it.
Wow. So, we'll share the contacts with you on the screen in just a moment. Go to the website if you want to be part of this. Commit to it. Live it. That's the most important thing. Getting now to the amazing work that's being done by many different partners, particularly on maternal health care in the country. You and your organization got several county governments to sign up to a petition committing to doing certain things. Tell us about that effort and how far along is it going?
So, Julie, I came here in April last year. I was with the Red Cross in Geneva before that. But the moment I came here, I could see, there was a dynamic in this country set by the First Lady of Kenya, Margaret Kenyatta, when she started the Beyond Zero campaign and she ran a half marathon. And actually, I came at the time when she was just finished running the London Marathon. Right. And I said, wow, here is a First Lady who's actually committed herself. It's not a photo op. She didn't go to the Kibera slum and pick up a baby and say, I'm all for maternal health. She actually ran it, and running a marathon,
I know, it's not easy.
It's not easy. It's exacting. So for her to personally do it, I just saw this as a great opportunity for the United Nations Population Fund. And for me, when I was coming here, the executive director of UNFPA, Dr. Babatunde Osotimen, gave me a very clear instruction. He says, your marching order for Kenya is to bring down maternal deaths. And just left it at that. So we came here, we sat down with the University of Nairobi and started doing a statistical analysis of all the 47 counties. And then after 3 days of intense data crunching, we had a eureka moment. And we found that 15 counties of Kenya contribute to 98% of maternal deaths. Yes.
No, 98%.
8%. So you can imagine the inequity also in terms of healthcare. And Kenya is amongst the 10 most dangerous places for a woman to give birth. That's a fact.
In the world.
In the world. It is a fact. I mean, the maternal mortality rates have fallen, but it's come down to about 400 for every 100,000 live births in a place like Mandera, so which translates essentially into about 6,000 to 7,000 women dying every year. So compare that at about 21 women dying every day. Now, if you had news of that sort, it would alarm people.
It would shock people.
But because it's happening annually, they become figures of statistics. So I think the First Lady did a great job there. And for us as UNFPA, we said, this is where our mandate is. This is where the core of our humanity also lies. And we also had a UN country team which is robust and felt that this is the way to go. And we all came together. So we had a discussion with James Macharia, the CS of Health. And being a banker, he immediately got it. He says, yes.
He looked at the numbers.
He looked at the numbers and he said, look, this is where we need to focus. I had a meeting with the First Lady. This was exactly her reaction. So what we did was we helped with the Ministry of Health convene a meeting with 15 county governors that came to the Boma Hotel, and we partnered with the Kenya Red Cross, with the World Bank, and with the other UN partners, UNICEF, WHO, and UNAIDS and UN Women. What was interesting was, till the last moment, we weren't sure if all the governors would actually show up. But everybody was surprised. The governors showed up, their wives showed up. I mean, we had expected 120 people. We got 270 that showed up for the meeting. There was a clear commitment to purpose. There was a clear signal that these governors gave that they are committed to it. So we said, all right, so this is a good opportunity to actually have a communique out there. So overseen by the CS of Health, James Macharia, and the UN resident coordinator, Nardos Bekele Thomas. All 15 governors signed up to a communique to end maternal death. But that communique also includes advancing adolescent health. That communique also includes ending harmful traditional practices such as FGM, such as child marriage. So it's a comprehensive communique, and they understood what they were signing up to. And I must say that a lot of these governors have taken responsibility for it and are really trying to bring that change.
Give us some of the highlights. Give us a county or two where you see the change starting to happen.
I mean, I can see it particularly in counties like in Mandera, in Wajir, in Marsabit. There's a whole commitment there. I was in Mandera on the 2nd of December 2014, actually with Ruth Kagia, who comes from the Office of the President, who's a senior advisor to the President, and partners from the UN system, civil society organizations, and the private sector. We had Philips there, for example. Right. It was a fateful day, a very tragic day in Kenyan history, where 36 people were killed. We arrived there. Despite that information, we decided we must go there in terms of solidarity.
What did you find? What did you find in terms of, you were going into the space to look at how the county had addressed its commitments towards, this agreement that was signed, its commitments towards maternal health care and all the other elements. But you go into that county on a day when, security-wise, absolute tragedy. Yeah. What did you find? Well,
we went there, and one thing that I have to compliment is the governor. He is a man who I have to give every credit to. Their hospital, the hospital that they have there, has come out from virtually the ashes of tragedy into a phoenix of hope. It's a beautiful facility. From what they have done over there with very limited resources, I think they've done an outstanding job. Despite that environment, there was a sense of confidence that they had. They felt that through their work and development, through ensuring access to basic services, they can turn their county around. Because it is a fact, when you go to Mandera, you see that it's been left out of the development curve for a long, long time. It's an intergenerational aspect. So there was a sense of commitment, a sense of purpose that was visible there. I've seen this in Wajir, seen this in many of the counties that I've been to. So what is important now is for the governors to take these several steps forward, because we didn't stop there. We made sure that we got the parliamentarians from these counties together to support their governors. And more recently, on the 4th of March, we actually had His Excellency, the President of Kenya, come and grace the occasion. We had a meeting with the religious leaders from these 15 counties, because we see them as critical players in also helping the governors.
So bringing all the stakeholders together in a common cause.
Are absolutely, because you can't have, it's like a jigsaw puzzle. That puzzle will not be completed if all aspects of it are there. The religious leaders hold a lot of sway on his flock, and their influence in terms of telling societies, telling communities on the importance of ending FGM, on the importance of child marriage. These are the things that will start initiating that change, because you can't have the government or a policeman sitting inside a household where a lot of these things happen. So I think it has to be multifaceted. From the rule of law point of view, I think the government of Kenya has done very, very well. I mean, the fact that they introduced the free maternal health care policy in 2013 has been a landmark. The amount of women, the 2014 KDH's data is already showing that the number of women, which was at about 44% getting skilled birth attendance, has gone up to about 67-68%. Right. Now, that's a remarkable jump.
Stay with the Africa Leadership Dialogues.
I think the Office of the Director of Public Prosecutions has been heavily engaged in things like anti-FGM,
That's right.
child marriage as well, and going into communities
That's right.
with education drives.
That's right. So again, as I said, these are multifaceted. You must have the shock and awe of law and the rule of law and justice, but there has to be that education at the community level of making them understand, because this is not about religion, it's a cultural practice which has been intergenerational, so they believe that this is the right way to go.
Speaking of cultural practice, and I hate to say this, I think you will understand because of South-South Cooperation, your home is India, gender violence, gender-based violence. And I say cultural practices because in some cultures it's not considered a big deal at all. And looking at the numbers that we've been going through, 41% of women in Kenya face some kind of violence. 41%, that's close to half.
That's close to half.
Sid, what's wrong? What's going on?
Well, like India, Kenya is a patriarchal society, period. And, to hit a woman is seen as a rite of passage, which is unfortunate. And I think, again, that change has to happen at home, at the household level, at the community level. Again, as I said, it has to be, the Director of Public Prosecution should be relentless in pursuing those who commit, these forms of shameful acts, whether it's domestic violence, whether it's sexual and gender-based violence. The case of Liz is similar to the case of the Delhi gang rape that happened in my own country, which really brought both Kenya and India into global prominence for something so tragic and unfortunate. So I just think that from a prosecution level, from a rule of law level, from the sensitization of the police forces, I think the rule of law, a lot of people forget that the police and law enforcement agencies don't come from Mars. They are children of that same community and society. So they also perceive that a woman, whether it's in India or in Kenya, that a woman has been beaten, oh, that's okay. So I think that temperament, that mentality has to change. So I think sensitization of the law enforcement agencies on the issues of women's rights, on the issues of gender, on the issue of respect, these are the critical issues that need to come in. I just think that is why the He for She campaign is so critical. I just think more men in this country need to be speaking out, and very loudly. Many more men joining the chorus along with the Vice President and the Deputy President, the parliamentarians, because it is that voice which carries through and resonates.
Which is important. Staying with the mindset issues, isn't it interesting, Sid, that in Kenya, more and more, we're seeing women bringing up children in single-parent homes. So you're seeing women going the extra mile constantly, and yet no appreciation for the role that they play. Yet their sons are growing up to hit their wives, we are seeing in statistics. Where is the gap? Is it the women we need to save, or is it actually the boys and the men who need the saving?
Well, I suppose it boils down to the basic issue of transforming those mindsets. And it's not impossible to do. Don't forget, the Chinese got rid of foot binding in not too short a time frame. But the important things to remember is that so long as the media like yourselves are a crucial opinion leader in getting that message repeatedly hammered home, I just think the whole issue of sexual and gender-based violence should be put into the national mainstream agenda and say, look, this is wrong, wrong, wrong. Let's change, because women constitute 50% of Kenyan society. Women are the drivers of the informal economy. Women are what will transform Kenya into already a prosperous country as it's trying to move ahead into a middle-income country. You can't leave 50% of your workforce behind. And WHO data shows that the amount of violence that is caused on women costs the country, costs the community. I mean, just imagine take for example, even when a woman dies giving, birth to a child. Look at the economic consequences of it. Let me simplify it. So the woman has gone into complications. The family realizes, and the traditional birth attendant realizes there's nothing much they can do. So that time that it has taken for the decision to take place has already cost a lot of time, energy, and money. They have to transport the woman to the hospital. She comes to the hospital, care, etc. given, and she dies. Then, as per Kenyan custom, you have to bury her, and that's again a whole this thing. What it is doing every time a woman dies, it is actually pushing the family further down into poverty. It's pushing the community down into poverty. And what happens then? The father is forced to marry off the girls early, so there is a lot of child marriage as a consequence of that. Girls drop off of school. Malnutrition sets into the household because the primary caregiver, the mother, the touch of the mother cannot be replaced by anybody. So I think from a violence perspective also, this is what it does. It makes societies dysfunctional. And it creates the sense of inequity where suddenly you have two levels of society. So I think, things like gender-based violence, things like FGM, things like child marriage were meant to keep women as underdogs. And I think that needs to change.
If you ever wondered why maternal health care is so important, you've just heard it from Sid. This is where it all begins. And, one of the things that you didn't mention when you talked about what a woman is, I think you did, she's the carer, she's the nurturer, she's the mother. Yeah. And without her, families, we're seeing the struggle.
Absolutely.
Let's go to anti-FGM and the drive that, the effort to ensure that we stop this practice. In some communities, it's still 90% plus. Why For anybody who asks you, why must we stop? What's wrong with FGM? What's your response?
Well, I mean, FGM solves no practical purpose. It causes grave damage to women. It causes obstetric fistula. Women die at childbirth. You know, there are just so many complications that go with it, with this unnatural process of cutting a woman. I think Kenya has done the right thing by legislating on it, because one of the good news part is, and this is really a compliment to the British government and to DFID in particular, which really put a fair amount of resources into supporting the government of Kenya's initiative together with the UN Population Fund, my organization, and UNICEF. We've really come together with civil society partners to address this over the last few years. The 2009 KDA survey showed 27%, which had fallen from about 35% in the previous survey. The survey now shows 21%. So there's good news. There's good news there. Yeah. Okay. And plus, I think in the Ministry of Planning and Devolution, you have a strong person in the senator who runs the anti-GBV board, and I think and she's really been very, very active. The important thing is, again, this is about the messaging going through. Again, this is about, I mean, you know, I was personally very pleased when the President of Kenya actually came for our meeting with the religious leaders, because we see them as a major stakeholder.
Right.
Because they need to be actually conveying this message down to their communities that, look, this is not a religious thing.
Are you engaging with elders in communities as well on this issue?
Absolutely.
Okay.
But, you know, finally the elders also refer back to the religious leaders, you know, and it's a customary thing, you know, it's not a religious thing, but it is a customary thing, and it's because of its intergenerational nature, it has not really been stopped. For example, there is, and you are right, you know, in a place like Mandera and Wajir, it's close to 99%. In the Maasai community, it's as high as, you know, in the 90%, you know, in the Kisi community and everywhere else. The issue is, again, it needs to be a combination of the sledgehammer of justice along with a very strong media campaign of ending this. It's a barbaric practice. I mean, as simple as that. And last and foremost is at the community level. How can we engage in terms of really nurturing, tutoring? Because it's a lot of mothers and grandmothers that go and get their daughters cut because they feel that their little girls will not have no future in terms of marriage. I think, again, this is a he for she issue.
Right.
Men need to speak up and say that we will not marry girls who've been cut. You'll automatically find it'll start to change.
In fact, the problem is that they say a lot of men do say they will not marry girls in those communities who have not been cut. And so men, if you stand up and speak out on this issue, it changes. Absolutely. It will change things. I also need to say, Lina Jebi Kilimo, a former minister in Kenya, has been pushing this anti-female genital mutilation drive, and she said she refused to have it done, or she resisted because she saw a woman who was successful who hadn't had it done and realized listen, I haven't had it done. There are so many women who haven't, and you can live a full life, have your children. There is no consequence to not having female genital mutilation. So please don't buy into the hype, basically.
And plus, in communities like in Mandera, the moment the woman is cut, she's married off. So as a result, that is why if you look at achieving their full human potential in terms of education, in terms of fulfilling their own aspirations, it all goes. In Samburu, for example, after a woman is cut, she has to walk to her husband's house. That same night the marriage is consummated. I mean, it's torture. It's torture.
There is no other word for it. It's torture.
But that's precisely why I really appreciate the government of Kenya to have passed strict legislation. The issue is enforcing it. Not allowing it to go underground, not allowing the medicalization of it, saying that no, we went to a surgeon and we got it cut. It just has no place in society.
Sid, I'm going to ask you to give a final word on these particular issues because we have a surprise for our viewers. Please do look into your camera and share your message with the country and our neighbors as well, Africa at large, on what we need to do in terms of the rights of women, gender-based violence, maternal health care. How can we transform this continent?
I think women are the foundations and the fundamentals of social progress. We all know that. We also know that women give life, and I would just echo the clarion call made by the First Lady of Kenya that no woman in Kenya or anywhere in Africa or anywhere in the world should die giving life. And I think the crucial part is for us men to speak up loudly to say enough is enough. There is no place for sexual and gender-based violence. There is no place for rituals like FGM and child marriage. There is no place for disrespect. It is about equality. That is where the foundations of Africa's progress will be laid.
Incredible. So the good news is this is only part one of our time with Sid. I know you're sitting at home thinking, what? The show is over? Next week, though, we're focusing on the issues of countering extremist violence. What can we do, particularly with regard to managing our youth and making sure that they do not get radicalized and are not used for violence? So that's coming up next week.
Stay with the Africa Leadership Dialogues.
My name is Siddharth Chatterjee. It's a tongue twister, so you can call me Sid. I'm the United Nations Population Fund representative to Kenya. And you're watching the Africa Leadership Dialogue.
Right now, let's get to your views on the issues.
This week we asked you, how can African states promote a conducive environment for reproductive health? Brenda Kanaiza says, by providing easier access to appropriate healthcare services and regular education on safer reproductive methods to ensure complete abolishment of old and unsafe methods of childbirth.
My name is Eric Makoa. I'm watching African Leadership Dialogue from Ongata Rongai. My take on reproductive health among African states is that it's something that is very important to the society. If the peoples are taught about reproductive health at a much earlier stage, let's say in primary school, like for example in Kenya, they will be able to know the do's and don'ts of embarking on sex. Like for example, if they are taught about family planning and contraceptives, they will know what to use and the options that are out there. This will help minimize early pregnancies and school dropouts of girls because of pregnancies.
To join our conversation, go to our G+ page, Africa Leadership Dialogues, on Facebook, Africa Leadership Dialogues, on Twitter, @AfricaLD, and on WhatsApp, send your video comments to +254 715 816 033.
And time now for Africa's Top 10.
This week on Africa's Top 10, we feature countries with the highest life expectancy rates at birth. The study indicates the number of years a newborn infant would live if the prevailing patterns of mortality at the time of its birth were to stay the same throughout its life. This is according to the World Economic Forum. Starting us off at number 10 is Namibia, with a life expectancy of 63.9 years and is ranked at number 114 globally. Coming in at number 9 is Madagascar, with a life expectancy of 64.2 years. The country is ranked globally number 113. Positioned at number 8 is Morocco. The North African state is ranked at position 92 globally with a life expectancy of 70.6 years. Taking the number 7 spot is Algeria with a life expectancy of 70.8 years and is ranked at number 90 globally. Slotted in at number 6 is Egypt, which is ranked 89th globally with a life expectancy of 70.9 years. Seychelles takes the number 5 spot with a life expectancy of 72.7 years and is ranked 83rd globally. At number 4 is Mauritius. Ranked at number 79 globally, the state attained a life expectancy of 73.6 years. Taking the number 3 spot is Cape Verde, with a global ranking at position 63 and a life expectancy of 74.5 years. Tunisia comes in at number 2 with a life expectancy of 75.1 years and is ranked at number 56 globally. And at number 1 this week is Libya. The North African country is ranked 54th globally with a life expectancy of 75.2 years. And that's Africa's Top 10 this week.
We end the show this week with an utterly profound African proverb. It's a little bit cheeky as well, but powerful. And it goes, looking at a king's mouth, one would never think he sucked his mother's breast. Perhaps it would be a much better world if we all stopped and remembered where we came from, and in particularly that we did suck our mother's breasts. Blessings to you and blessings to Africa.